In 2021, 546. In 2022, 853. Is it humane for a government to have pull factors to bring people across the border on a perilous journey, as you have described, with a death rate of that? When, March 5th of 2019, the New York Times claimed that the border was at its breaking point as more than 76,000 unauthorized migrants crossed in more than a month in February of 2019. It was at a breaking point under a different administration, so perhaps there is politics involved. Are you aware of how much money the cartels make in smuggling people across the border? $13.5 billion. Does that help to ameliorate any of the poverty or economic disadvantage or lack of health care in any of these countries? No, it does not. Are you aware that $51.6 billion in remittances went back from illegal migrants in the United States to Mexico? And does that have anything to do with why we cannot control our southern border? Fentanyl and fentanyl analogs have been responsible in 2019 for 28,000 deaths, in 2020 for 28,000 deaths from flu, 38,000 deaths from auto accidents. For fentanyl, the overdose deaths in 2020 was 91,799, 2021, 106,000, and this year, which is not yet available because we're a year behind. We consider flu at 28,000 deaths a year to be endemic. I would say that this would classify as an epidemic, our fentanyl opioid crisis. The Council on Foreign Relations called it that, the CDC has called it an epidemic, and the Washington Post in December of 2022 has called it an epidemic. Mr. Judge, you mentioned, and I just want us to underscore this point again because there seems to be people who don't understand the connection between fentanyl coming across our border. Again, are illegal drugs coming across the border and are illegal immigrants being used as a decoy to allow drugs to come through places other than ports of entry?
Every single day.
Thank you. Now that we've had the CDC, the Washington Post, the Council on Foreign Relations call the opioid crisis, the opioid and fentanyl epidemic, an epidemic, Mr. Archer, currently Title 42 authorizes the HHS Secretary to restrict persons and importations from foreign countries to prevent the introduction and spread of communicable diseases. The purpose of this authority is to protect the public health from serious danger. As has clearly been discussed, and as I've just alluded, by non-right-wing publications who have considered the fentanyl crisis as an epidemic, as established today, fentanyl analogs are a clear and present serious danger to the public health of our communities and constituents. Would updating Title 42 to include certain substances, such as fentanyl and fentanyl analogs, and specific opioids and narcotics, be helpful to you and agencies, companies, and communities that you serve?
Yes.
Thank you very much. I yield back.
Thank the gentlelady for yielding back. Now recognize gentlelady Ms. Kamick for her 5 minutes.
Well, thank you, Mr. Chairman. Thank you to everyone for making the trip down here. Thank you to our witnesses. We'll jump right into it. Going down the line, Sheriff, do you believe that we have a crisis at the southwest border?
Yes, ma'am.
Doctor?
Yep. I would say, look, I'm not, as a healthcare provider, I'm more of an expert about what happens when it
Just
comes
yes
over
or
the
no,
border.
please.
I can speak to if,
You
we don't have the
personally do
infrastructure
yes,
there.
just yes or no?
Look, I'm not an expert on border or immigration policies. I think I can
Okay.
talk to what happens on the other side if we don't.
Okay,
have-
so I'm sorry, I have to reclaim my time. Ms. Garza, do we have a crisis at the southwest border? Yes.
We have a humanitarian crisis, yes.
Thank you.
I don't just believe, I know we have a crisis.
Thank you. Ms. Garza, how many shifts or ride-alongs have you done with Customs and Border Patrol agents or Texas DPS?
Actually, a few. I have represented hundreds of children in immigration
when did you do these
detention
ride-alongs?
locally. In 2018, 2017. It's been some time. I spent some time at OFO, also on the bridge on the ports of
I'm sorry, I'm
entry
going to
and
reclaim my
spoken
time.
with people.
So you have not done a ride-along or worked a shift along Texas DPS or our Border Patrol agents since the Biden administration has been in office?
Ma'am, I've been practicing immigration law
Or
since
yes
the
or no?
Obama administration in this region.
That's just a yes or no? Yes or no?
Ma'am, I've been practicing immigration
That's
law. I'm
not
an
answering my
attorney.
question.
I'm not a police officer.
Okay.
I'm not an officer.
So then you haven't. So you said earlier, quote, Operation Lone Star has not resulted in any sort of reduction of fentanyl deaths in your respective districts, talking about our districts, end quote. You referenced Operation Lone Star more than 3 times today in your testimony and in answering questions, saying that it's essentially a waste of taxpayer funds.
Yes.
I want to look at the results of Operation Lone Star to date since it took place in 2021. 361 million lethal doses of fentanyl have been apprehended, have been confiscated. That's just Operation Lone Star. That doesn't include what CBP or Border Patrol has actually confiscated. So going back to what you said, that Operation Lone Star is not stopping any fentanyl deaths, that it's a waste of money. How do you explain the 361 million lethal doses that have been confiscated? And I guess in your opinion, what is the price of a life then?
We are talking about billions of dollars that have further militarized this region and the state of Texas. It has been a waste of taxpayer
361 million
dollars.
lethal doses is a waste of taxpayer dollars?
Look, we both care about a solution here. We
Is
need to address the fentanyl issue.
I'm going to reclaim my
but it
time.
is
When I
not
reclaim my time, that
through
means you have to stop talking.
militarization.
361 million lethal doses is a waste of taxpayer money, in your opinion, yes or no?
I believe that Operation Lone Star is illegal.
So you
and that
think it is a waste of money?
of
Ms. Garza, you
taxpayer
stated,
dollars.
you said, quote, I don't understand why we are here at the border. There is no connection, end quote. Let me show you what the connection is. This is a brick of fentanyl that was found in my district in Florida, in Marion County. This is 958 grams of fentanyl. The people who had that brick of fentanyl crossed the border illegally. That is the connection. And it's not just my district. Every single one of these members here today have illegal substances in their district as a result of the Biden open border policies. That is the connection. Every single one of us has constituents who have been poisoned as a result. To say that there is no connection, that is wildly inappropriate, unacceptable. And to the families that have lost loved ones as a result of the open border policies, you should apologize. There is a direct connection. It's right here. In my
Ma'am, they are not coming on the backs of individuals that are seeking asylum. That is
in
a
my
fact.
county, Marion County, and I represent 12 counties. In Marion County alone, over 70% of the 200 monthly overdoses are fentanyl. These are fentanyl poisonings. And as it has been made clear here today by my colleagues, only 5 to 10% of the fentanyl that is being smuggled over the border into the United States is documented. That's what we know of. This is a crisis. I only have about 25 seconds, so I'm going to end with this. Do you agree? Because I went through your Twitter feed, I went through several of the things that you've posted. You talk a lot about social justice. Do you believe that social justice is Biden taking $130 million from homeless veterans programs under FEMA and redirecting it to the border crisis here?
I believe that you're using the border as a political talking point.
Please answer the question.
And we do not appreciate that.
Answer the question. Let the record reflect that the witness has declined to answer the question under oath.
All right, we'll so
yield.
reflect. Gentlelady yields back. Recognizes the gentleman, Mr. Wahlberg, for his 5 minutes of questions.
I thank the chairman and I thank the witnesses for being here, and I thank my fellow committee members for taking the trip down here. And Mr. Chairman, I think this is a good pattern to have on a regular basis of going out to the places we're finding information from and talking to people. I represent a district that goes from Lake Michigan to Lake Erie, the borders with Canada. We have illegal drugs being smuggled across Canada and from Canada in interesting ways. Scuba divers coming across the Detroit River, Lake Erie, to our district, but nothing at the level of what we're seeing here. I must admit that. Last week I held a teletown hall in my district and heard from Michiganders across the 5th District. And one community, Dowagiac, Michigan, over on the west side of the state, in fact, told me a person said that they had had 8 fentanyl overdoses happen in their town in 1 week this year already. 8 people in 1 week in a town of 5,000 people, and that's unacceptable. In my district as well, we have, as far as I know, the only facility of its kind that provides low-income housing for individuals who have come through treatment centers and are trying to make it, and rather going back to the communities from which they came, they come to Andy's place, and they have a full panoply of services there: legal services, social services, psychiatric services, job training services, all in the building, and the peer pressure in the positive way that goes with that. We began to see 2 years ago that facility begin to be able to keep up with people coming in. That's all changed now. Waiting lists has increased. Clearly, this administration is failing to protect Americans from the scourge of illicit fentanyl coming in through the southern border, and we've seen that take place. Mr. Archer, with 8 overdoses in just one small town, I'm concerned about the ability of our hospitals to keep up and provide good quality care. Our healthcare workers are already being stretched thin as a result of COVID and the shutdowns and all that went with that. How is the fentanyl crisis contributing to this issue with hospitals specifically?
Thank you for the question. I think our hospitals in this nation have never been in a more perilous position. I think post-COVID, we've got a very brittle healthcare system with stressed out workers across the continuum. In a hospital, any community's first goal and biggest focus has to be on its own community. It has to be those that they call neighbors and loved ones. And so I think any massive flow of patients of this type would severely strain and has a risk of breaking many of the health systems.
That is a concern, and then the impact that it has on families trying to deal with that as well. The care, the cost, the upheaval in life also. Mr. Judd, thank you for your longtime service for our country. You've had an opportunity to talk about some things that you need. Specifically, you've said we need more Border Patrol agents. We accept that. In what we saw today, even in the processing center, and how many staff were needed from all aspects of the border protection, and then not on the border. In a list of priorities, what works best in tools for securing the border? Could you list it priority-wise, starting with Border Patrol agents? Yes, but...
Yeah, look, I never want to put the cart before the horse. I will always say that we have to have policy. Policy is the number one thing that we need. Once we have policy, then we can evaluate what else is necessary. After policy, I would then say personnel, both at the ports of entry, between the ports of entry. Once you have the personnel, then I would say technology such as infrastructure. Once you have the infrastructure, you can work down. But you have to see what works and then work down. Otherwise, all you're doing is wasting taxpayer dollars, and I don't want to do that.
When we saw infrastructure upgraded just a few years ago, even on the most eastern edge of this area, the Rio Grande Valley area, when we saw infrastructure, whether it was water, whether it was electronics, did we see significant downgrading of the influx at the border?
So where we really saw it was in policy. Once President Trump implemented the migrant protection protocols, that's when we saw it. But then couple that with everything else, yes, that's what happened. But even President Trump struggled with illegal immigration until he implemented the migrant protection protocols. He created the will. We always say don't recreate the will. He did create the will because no will existed, and he had to do it.
Thank you. My time has expired. I yield back.
Gentleman yields back, and now recognize Mr. Weber for his 5 minutes.
Thank you. I'm not going to have a whole lot of questions. I'm going to give you some background. I served in the Texas legislature for 4 years with Rick Perry, with Governor Abbott, now Governor Abbott. Operation Lone Star is a huge success. When we were in the back then in the border in 2011, when I was in the legislature, Steve McCraw, director of DPS, told me personally that 5,000 Texans had been injured, violently raped, pistol whipped, pistol beaten, homes burglarized, cars stolen, businesses broken into by people, illegals who aren't even supposed to be here. That's 5,000 Texans back in 2011. I shudder to think what it is now, Brandon. The latest provisional mortality data from CDC, y'all know this, has come out for in January 12 months ending in 22, 80,590 deaths, 75%, 66.5% were involved in synthetic opioids, primarily illicitly manufactured fentanyl. Look at the CDC's website. They're on the rise. 2020, it was 57,000 deaths. Now it's 71,000 deaths. If you divide 71,450 deaths by 365 days, it's 195 deaths a day from fentanyl. If only 20% of those deaths from the open border came through the open border instead of those ports of entry that have been touted here, all right, then 20% of 71,450 deaths. Oh gosh, that's only 14,000 deaths a day. Wow, that's almost one passenger airliner a week crashing in our country. How long do you think that would go on before Americans would rise up and say enough is enough? I was also on the Pub Ed Committee in the Texas legislature. Texas has, this is from mypublicschooltexas.org. I looked up the different .org. I looked up the stats. 1,026 districts, 5.5 million students. Divide that out. The average school district is about 5,360 students, K through 12. When you brought in 70,000 unaccompanied minors 2 summers ago, you just brought in 13 complete school districts. Somebody has to pay to educate. Folks, we cannot be the charity for the world. And if you want to be gracious about the school district figures, dare I call it liberal, let's use 10,000 students as the average school district in Texas. Oh gosh, then it's only 7 complete school districts every summer that we're bringing in that somebody has to continue. We absolutely can't do this. Your heart goes out to people who are in countries less fortunate than we are. We cannot be the charity for the world. There is a system set up for them to seek asylum, seek sanctuary, if you want to choose that word. Stay in their system, make the claim that they're persecuted by their government, they're persecuted for their religion, or they're part of a group that is persecuted, whether it's due to their sex or their religion or whatever. Those are the 3 reasons to want to claim they need asylum. Do it in their own country before they come here. I speak Spanish, un poquito más o menos. Nosotros de ustedes, o todos de ustedes necesitan aprender español, ¿verdad, señorita Garza? Sí. You all need to learn Spanish. I've been on the border 9 times. Every single person that I have spoken to on the border in Spanish since I've been here has said they're coming for the jobs. They're coming for the jobs. Not that they're scared of their government, not that they're scared of the drug cartel, not that they're persecuted for their religion or anything else. They're coming here for the jobs. We absolutely can't continue to do this. I'm going to go to you, Mr. Brandon, Mr. Judd. If, in fact, in 2011, and you're taking my words for it, I know what I learned with the DPS when I was in the legislature, that there was 5,000 Texans who were violently robbed, violated, raped, some of them violently raped in 2011. And you were there, you were on the Border Patrol in 2011, right?
Yes.
How much would you guesstimate that's increased in today under Biden's open border?
In 2011, I believe that we apprehended somewhere around 400,000, between 400,000 and 500,000. Today, we're apprehending between 2 million and 2.3 million. So therefore, it stands to reason that it would increase by the exact same number. So 5 times more.
That's unbelievable. And I know that there was a comment made that we need to separate this into 2 things. It's, we want to try to make this a dual. It's about border security. It's about saving American lives, and that's simple, and I yield back.
Gentleman yields back, and now recognize Mr. Allen for his 5 minutes.
Well, thank you, Mr. Chairman, and we all got up early and traveled here today. What I've learned so far, and what I've learned since serving on the committees, starting my service here in the 118th Congress, has made me very aware of a serious problem that we have in this country. Our nation is being invaded, laws are being ignored, and young people are dying. We are at war, and we don't even know it. And this is not a stunt. And I think the name is appropriate. I mean, the Commander-in-Chief of the United States of America is supposed to protect the American people. I mean, national security should be number one. This administration, including Secretary Mayorkas and Attorney General Garland, are ignoring the current immigration laws of this land and handcuffing the very people from enforcing it. In 1971, then President Nixon declared war on drugs in America. Under the Reagan administration, President Reagan reinforced and expanded many of Nixon's war on drugs. In 1984, his wife, Nancy Reagan, launched the Just Say No. In 1986, under President Reagan, Congress passed the Anti-Drug Abuse Act, which established mandatory minimum prison sentences for certain drug offenses, which is the very thing we're talking about and begging for here today, is to deal with this enemy. You know, and then again, talking about the people in South America, you know, there are a lot of churches in my district that have missionaries in South America. I've been there with my children. These are good people. Now, we poured floors in huts that had floors of mud. We built latrines where they didn't have bathrooms. We planted churches. We built churches. We built schools. And let me tell you, these people of faith have the strongest faith I've ever seen in my life. They love their country, but unfortunately their country is run by corrupt leaders and cartels who absolutely, it's an abomination what they do to their people. And they, you know, they want to stay there in their country. You know, the thing that you know, that really gets me is, why can't we solve this problem? I mean, we got good people that want, I believe, the same thing, but you know, it's like, how do we get there? And you know, Mr. Judd, what will it take for you to secure that border? I mean, if we give you full authority, if I were President of the United States and I said, secure that border, what would you do?
I've lived through it already. I know what's necessary. We need policy.
You know exactly what needs to be done.
We need policy,
okay.
Absolutely.
Is anybody in the White House listening to you?
No, absolutely not.
Okay, all right. The cartels, we've already learned, you know, what they're about and whether they should be declared terrorist organizations. I am signed off. I have co-signed that AUMF. To declare war on those cartels. And I think we need to take your advice because they are very, very different. I mean, they are bad people.
They are.
My question is, how many of the cartels have infiltrated the United States?
There's plenty of testimony, there's plenty of evidence to show that they operate here in the United States. They don't just operate in Mexico, they don't just operate in China, they operate here in the United States. Once it crosses the border illegally, then it's facilitated by those organizations throughout the entire United States, whether that's Iowa, whether that's Minnesota, whether that's Michigan. It doesn't matter, it's everywhere, including Maine.
Obviously, there are crime syndicates all over the country. The FBI has been very successful in dealing with that through history. And obviously, I think we need to bring the FBI in and see really what they're doing to help you and the sheriff to deal with this. Because we take an oath to the Constitution to protect the American people against enemies, both foreign and domestic. And we need, as a Congress, to get it done. Thank you for being here in your testimony, and with that, I yield back.
Thank